Deteriorating health services. This is what these residents say they are experiencing of late. A Nababeep resident near Springbok, Deborah Philip, says she had a traumatic labour experience. Philip was forced to deliver her now 2-month-old son at home. She says following the birth, she had to take a taxi to the nearest hospital for the umbilical cord to be cut. Philip says no ambulance was deployed to assist her.
Die naaldstring wat my babatjie aan was, ek moes uitgaan met dit tot by die taxi loop. As 'n hele afstand van ons uit die huis uit tot by die hek. En dit was vernederend om te dink dat ek kan nie glo dat die ambulans nie kan uitgekom het, want dit was basies 'n uur wat, letterlik 'n uur wat ons moes gewag het. En toe moes ek nou nog daai klas tipe ervaring en ek weet nie wat ek sou gemaak het as ek moes my kind verloor het, want soos ek sê, dit is 'n saak van lewe en dood geweest. Maar ek moes maar toe so, maar by die taxi uitkom en maar by die hospitaal uitkom op so 'n manier. En
Philip is elated her child made it through despite the difficult challenges.
Ek voel eintlik baie gelukkig en bly en ek voel dit was maar ook ek weet nie baie mense sal so gelukkig soos ek gewees het, maar soos ek sê, laas keer ook gesê toe my kind kom, was het so gesonde babatjie, hy het onmiddellik so gehuil en alles die. En ek het mos nou op daai stadium die hulp van kliniek dames ook hier gehad, maar so ek sê baie mense is nie gelukkig soos ek en dit is maar hartverskeurend om te dink as my storie kan 'n verskil maak, dat baie mense, daar's mense wat op plaasgebiede bly, wat nou maklik daai hulp en ondersteuning soos ek kon gehad het, en dan kom die ambulans nie uit. Ek weet nie, maar ek was maar net een van die gelukkiges as ek dit kan so stel.
Another affected resident is 70-year-old Francis Makatias, who had a similar experience. Makatias, who was diagnosed with breast cancer earlier this year, says trips to the nearest health facility are harrowing and frustrating.
Om baie eerlik te wees, is ek nogal teleurgesteld aan die behandeling wat ons kry. Want nommer 1 is dit buite die hospitaal, wat ek moet staan wat oor 70 al is. Ek is al 'n groot vrou. Ek het kanker, my kanker het versprei in my bene. En ek kan nie lank op my bene staan nie. En daar moet jy nou wag tot die ambulans eendag besluit om te kom.
Other residents are equally frustrated with the deteriorating situation.
Dit is die regie van die mense sterf en die mense word doodgesteek en alles, dan moet ons vir Appington bel om 'n ambulans te kan kry. En ek het 'n geval gehad van my buurman wat gesterf het. Hy was 14 en ek het gebel en as 'n nommer wat jy bel, wat jy met airtime het en jou airtime loop uit. En ek het weer gebel en my airtime het weer uitgeloop. En toe te later maar die radiostasie gebel om vir ons te help.
A paramedic who broke his silence about the situation says their working conditions are poor.
The work morale has gotten so low that employees, they just want to get in and get out. They are forced to work under certain conditions via threats and intimidation tactics to overwork themselves. Just this week, we've lost a colleague in a different district due to overwork. And these things are unacceptable. They should not happen. Because if our government, our provincial government operate within the law, then our ambulances and our staffing will be sorted out and our patients would be sorted out. Well, it's simply they don't care about the people in Namaqualand. Our cries fall on, on mute ears.
Meanwhile, the Northern Cape Health Department says they are on top of the situation.
Those who are high risk, those are the ones that we must respond immediately to. And then the others we respond, on a sliding scale, if I can call it like that. So if I bump my toe, I will have to wait for a person to be first picked up who is having a heart attack or a mother who is going into labor. And then I will be picked up next. So the pressure that you have in terms of EMS will always be there because we don't have a private sector like other provinces. But and so as such, more than 80% of our communities rely on us.
With these challenges remaining, Philip and many others in her area will continue to face an uphill battle in accessing emergency health services. Reginald Witbooi, SABC News, Springbok in Namaqualand.